Hello, my name is Marian Knight and I'm a Professor of Maternal and Child Population Health in Oxford. I'm a public health physician, and for the past year or so I've been conducting research into COVID-19 in pregnant women in the UK. And I've been asked to talk about particularly COVID vaccinations, which have been in the news recently. They've been in the news for several reasons, because we know that sadly infections in pregnant women are increasing. So we know that over the past couple of months we've seen increasing numbers of pregnant women admitted to hospital with COVID. And COVID does have significant consequences in pregnancy. We know that if you're admitted to hospital with symptoms of COVID when you're pregnant, you've got about a 1 in 10 chance of needing intensive care, and about a 1 in 5 chance of having a premature birth. And obviously we know that being born preterm can have long-term health consequences for babies and children as they grow up. And therefore vaccinations is obviously particularly in the news. One other reason why vaccinations have been in the news is because we know from surveys that the Royal Colleges of Midwives and Obstetricians and Gynecologists have undertaken that there are some concerns around having a vaccine in pregnancy amongst pregnant women. Although we know from information released last week that more than 50,000 women in England have received a dose of vaccine in pregnancy, and more than 5,000 women in Scotland. And we have information now on more than 200,000 women in both the UK and the US who've had a vaccine in pregnancy, and there's been no safety concerns about the vaccine in those women. Those women have all received either the Pfizer vaccine or the Moderna vaccine, and that's why we're recommending those specific 2 vaccines for pregnant women, because those are the ones that we have the most information about. There may be some of you who have been fortunate enough to have your first dose before you become pregnant, and are now pregnant and are querying whether you should have your second dose. And the recommendation is that you should get your second dose. And as you know, the gap that is recommended now in the UK is thinking about 8 weeks between vaccine doses. So that's come down from 12 weeks. And it is recommended that you get the vaccine doses with that spacing. The Royal Colleges are suggesting that some women may want to wait until they're about 14 weeks of pregnancy to get either their first or second dose. But that's not because we've got any concerns over a safety of vaccine at any particular trimester in pregnancy, but simply because we know that some women prefer to avoid any medications in the first trimester of pregnancy. One other thing it's important to know about the vaccine, not only does it protect you, because we know that of the women that have been admitted to hospital recently, the vast majority have not had a vaccine. It also protects your baby, because we do know that your antibodies can cross the placenta. The other thing it's important to think about is that we know that the period you're most at risk of severe COVID in pregnancy is in the second half of pregnancy, so the late second trimester or the third trimester of pregnancy. So actually getting a vaccine before that is important. And I would say it is important to get 2 doses, because we know that 1 dose gives you some protection, but 2 doses gives you much better protection. So of the very small number of women that have been admitted to hospital with COVID in pregnancy after vaccination, they've only had 1 dose rather than 2 doses. So again, it does give you really significant protection. Perhaps the one last thing for people to think about if they're at all concerned about safety in pregnancy is to think about other vaccines. So the COVID vaccine is not a live vaccine. You're not getting any virus, and it's very similar to other vaccines used in pregnancy. We're all very used to getting our flu jabs, which is recommended for pregnant women, and the other jab, which you'll all be recommended, is the whooping cough jab. And they're both very similar. Then they protect you, but they also protect your baby. So there's no doubt in my mind that your risks from getting COVID are much, much greater than any theoretical concerns about safety of vaccination in pregnancy.